Labor's health spokesperson Annette King has challenged the Health Minister Jonathan Coleman to eat what she describes as slops at Dunedin Hospital. Dunedin Hospital's patient meals have faced criticism since private company Compass took over in February. The meals are now sent frozen from Auckland and Tauranga to Dunedin and Southland hospitals, and they're also provided to Meals on Wheels customers. Patients have described the meals as awful and bland and all sorts of other descriptions. A Meals on Wheels volunteer we spoke with in February said she wouldn't feed one of the meals she delivered to a pensioner to her dog. Annette King challenged Dr Coleman, who was in Dunedin today for the National Rural Health Conference, to taste one of the meals while he was in town.
Yes, I did. He wasn't in the house yesterday when I asked a series of questions, which were answered by Sam Lottoinga, his associate. And as I came out of the chamber, I was asked what should happen, and the challenge was put out by me, well, if he's going to Dunedin, why doesn't he taste the food? Because it's not me that's saying it, it's the patients that are saying it. And if he doesn't believe them, then he ought to be the test kitchen.
And so the idea, I presume, was that he would taste the same food everyone else gets at the same time everyone else gets it, right? Was that your intention?
Yes, I wasn't thinking that he'd have a little private tasting without any media there, and us not knowing actually what is he tasting. I thought he probably should walk onto the ward, walk up to a bed where someone's about to have their lunch or their dinner, and say, "Can I taste a little bit of that?"
Yes, but instead, what's happening?
Behind closed doors, he is going to taste something that is part of the food that people receive. So we really don't know, John. So I don't think it's a real taste kitchen by the Minister. I think it's a bit of a cop-out.
Are we surprised by this? Isn't hospital food always bad?
No. In fact, one of the areas that did have pretty nice food was Invercargill and Dunedin, because they had, Dunedin in particular had beautiful kitchens. They spent over $1 million on their kitchens, and I've actually have tried some of their food. And, of course it's not exactly the same as you'd have at home, but it's cooked on the premises and served. What they're getting now is cooked in Auckland. It is then chilled and brought down to Dunedin and Invercargill, and then it's reheated. And as it's been pointed out, when you're on a plane and you have similar food, each dish is done individually. So, you get your little dish, they take the piece of tin foil off and there's your meal. When these hospital ones come in great big carriers, they then plate it up and heat it up, which is why I think some of it looks appalling. And as has been said, the potatoes are rubbery or no taste. The combinations are dreadful. So, I think what's happening is that people aren't getting what they were used to, and that is why, particularly in Meals on Wheels, people are walking away from even getting those meals.
Annette King, Labor's health spokesperson. So, what did the Minister say? Well, just a few minutes ago, our reporter Kate Newton spoke with Dr Coleman on his way to Dunedin Airport and asked him what he ate and what he thought of his meal.
I had a very good meal about 4 o'clock this afternoon of pea and ham soup, followed by pasta bolognese. And I can tell you what, it was delicious. It was nutritious food. It was more than a tasting. I ate the whole thing. I won't need dinner tonight. And look, quite frankly, Annette King, she must be spending too much time in elitist Wellington restaurants, because this was good, basic Kiwi food that ordinary working Kiwis are eating at dinner every night of the week, and there's nothing wrong with it. Be very happy to eat it again, and I stand by the nutrition standards of the food served at Dunedin Hospital.
We've all seen the photos of patient meals that patients have been posting from Dunedin Hospital. Do you seriously believe that it was exactly what the patients got served today and they didn't jazz it up for you?
Well, yep, I seriously believe that, and think otherwise you'd have to be accusing the kitchen staff of lying, and they are absolutely straight up about it. They're actually deeply offended by what Annette King has been saying about the food they produce in that kitchen there. They work very hard. They do their very best by the patients. There are nutrition standards there. And I quizzed them about the food. They said it was absolutely off the lunchtime menu, which I've got a copy of, and it's exactly the same food that was served in Dunedin Hospital today. So really, I think this is all a beat up. Look, you can rearrange food on a plate to look as bad as you possibly want. I'm sure there's government critics and opponents out there who, with nothing better to talk about, now want to attack hospital food. But Annette King needs to, stop being so elitist and actually get in touch with the sort of food that, frankly, Kiwis are eating on an everyday basis. So big own goal from her.
One thing I did note is not many veggies there, were there?
Look, this was the lunchtime menu. It was a bolognese. There was an apple there. There was some bread. There was pea and ham soup. So, yep, you could dissect the individual meal, but look, it's part of a balanced dietary plan that they produce overall for people who are in the hospital.